Here we are going to discuss few question and answer about physical assessment, and this question frequently asking in NCLEX licensing exam. The first question here: a elderly client has a history of aortic stenosis. Identify the area where the nurse should place the stethoscope to best hear the murmur. So aortic stenosis or aortic valve stenosis is the narrowing of the heart aortic valves, and the valves which is separate the left ventricle from the aorta. So here the body surface area, we have to put the icon where the aortic valve is there. In the same time, I'm going to show you the picture, pulmonary area, tricuspid and mitral areas. So aortic area in the second intercostal space to the right, but second intercostal space to left border is a pulmonary areas in this picture. And tricuspid area, it is typically heard in the right sternal margin of the fifth intercostal space, and mitral valves heard over the heart apex in fifth intercostal space in a line with the middle of the clavicle. So clavicle is these bones, and here it is. If you draw an imaginary line mid of the clavicle, where this imaginary line cut in the fifth intercostal space, this is the mitral areas. So we have to put the stethoscope in this green square areas. So the murmur of aortic stenosis is a low pitch, rough, and it is heard loudest in the second intercostal space to the right of the left sternum. So let me recap it. There are four areas listening to the heart sound: pulmonary or aortic, mitral, and tricuspid. So aortic sound we best heard in the second intercostal space at the right. Pulmonary, second intercostal space at the left. And mitral and tricuspid. Next question here. While examining the hands of a client with osteoarthritis, so our patient has a osteoarthritis. It is the inflammation of one or more joints. It is the most common form of arthritis that affect the joints in the hands, spine, knee, or hips. So the nurse note the abundance nodules on the second fingers. So identify the area on the fingers where the nurse observe the nodes. So is it in the tip, first joint, or second? Correct answer is in the second distal interphalanx joints. So abundance nodes appears in the distal interphalangeal joints, and this bony or cartilaginous enlargement are usually hard and painless and typically occurs in the middle age and elderly client with a osteoarthritis. And next question, before to go next question, I want to recap something. So this is the green area what the distal interphalangeal joints. We get the abundance nodules. So what is abundance nodules? A small fixed bump-like deformities on the fingers, usually at last joint of the finger. Abundance nodules is a calcified of the joint or articular cartilage and is a sign of osteoarthritis. That's it. Next question here. A nurse is caring for a client who is experiencing alcohol withdrawals. Which statement the best indicates that the client is understand the need for long-term treatments? So withdrawal syndrome is very important for NCLEX board exam. The various physical and psychological effect of detoxification can occur after reducing or cessations of drugs or alcohol. There are 4 options. The client agreed to attend supportive counseling. Number 2, the client agreed to involve his family in psychotherapy. The client is agreed ongoing participation in one or more support groups. Number 4, the client is agreed to detoxification, rehabilitation, and participation in an aftercare program. So best answer is number 4. The client is agreed for detoxification. The client is agreed for rehabilitation and participate in an aftercare program. The rationale said detoxification, rehabilitation, and participation in aftercare program are the only option that address the client's long-term treatment needs. Supportive counseling or family involvement and supporting group participation are important aspects of the treatment process, but they do not address the client's needs for long-term treatment. Here I left few symptoms and signs of the alcohol withdrawal syndrome. And NCLEX board like to ask the question from here. The common sign after they stop the alcohol intake who are alcoholic: anxiety, agitation, irritabilities, nausea, vomiting, diarrhea, convulsion, and insomnia. Some patients complain tremor or hallucination, sweating, fever with or without infection, delirium, tachycardia, and hypertension. Next question here, a client has a lymphedema, right? Lymphedema in the both arms, and the nurse must need to measure blood pressure using the thigh cuff. In reference to the client baseline arms blood pressure, the nurse should expect the blood pressure in the thigh to have a high systolic blood pressure, high diastolic blood pressure, lower systolic blood pressure, or lower diastolic blood pressure. So my patient has a lymphedema or lymphoedema, lymphatic edema. It is a condition that results in the swelling the legs or arms. It occurs due to the blockage in the lymphatic system, which is the part of our immune system. Whatever it is, this question, my two arms has a edema. Now nurse came to check the blood pressure in my legs. Is it higher than my upper extremity blood pressure, systole or diastole, or low? This is the note. Usually higher systolic blood pressure reading, but diastole should be same. The rationale: systolic reading in the thigh may be 10 to 40 millimeter mercury higher than the upper extremities. Diastolic reading are the same in upper and lower extremities, or in the arms or thigh. It is the information we learn from here. In this picture showing, this is the radial artery. If I need to check the blood pressure in my radial arteries, position of the limb at the level of heart and place the cuff above the wrist, auscultate radial arteries. What else? If need to check the brachial pulses or blood pressure in brachial artery, position of the limb at the level of heart and place the cuff on overarms, auscultate brachial arteries. This is the stethoscope, auscultate. This is the dorsal pedis artery in the legs, and here the popliteal artery in the knee joints. When I need to check the blood pressure in the legs, place the cuff above the middle malleolus and auscultate either posterior tibial artery or the dorsalis pedis arteries, either this or here. If need to check popliteal artery, place the cuff above the knees, but here below. Auscultate popliteal arteries. Next question here. A nurse is assigning a client abdomens. Which examination techniques should the nurse use first? Auscultate, we usually use the stethoscope. Inspect, so what we can see by eyes, percussion, just tapering, and palpation, superficial and deep. They said, which examination technique should the nurse use first? Definitely answer is inspection. Next question. A client with a spinal cord injury and say he has difficulty to recognizing the symptoms of urinary tract infection. So which symptoms is an early sign of UTI in a client with a spinal cord injuries? So a urinary tract infection is an infection in any part of the urinary systems, maybe kidney, ureter, bladder, or urethra. The most infection involve our lower urinary tract, the bladder and urethra. And women are at the greater risk of develop UTI than the men. And infection is limited to the bladder, can be painful, right? So they said maybe the lower back pain, but here the question is a little bit different. They said has a difficulty recognize the symptom urinary infection because of spinal cord injuries. So which symptoms is early sign of UTI? Low back pain, burning sensation on urination, frequency of urination, fever, and change the urine clarities. Answer is the fever, UTI, urinary infection, neutrophil go up, patient develop fever. This is the first sign of infection. Rational fever and change in urine clarities is the early sign of UTI in a client with a spinal cord injury. Lower back pain is a late sign. A client with a spinal cord injury may not experience a burning sensation or urinary frequency. Next question here. When obtaining a client history, a nurse developed a genogram. Which of the purpose of developing a genogram? So what is genogram? Let me show you this picture. This is the genogram. So a genogram is a graphical representation of a family trees that is displays the details data on relationship among the individuals, and it goes beyond a traditional family tree by allowing the user to analyze the hereditary pattern and psychological factor that is related to the relationship. So here we can see maternal or grandmother side, and here we can see paternal and paternal grandmother side, right? And here showing sibling, mother, sibling, and then this is united, one family, another family, father and mother, and they have a 2 childs. So the genogram we analyze this because of the hereditary disease or familial disease, right? So they said which of what purpose to develop it. Number 1, identify genetic disorder and familial health problems. Identify previously undetectable disease or disorder. Number 3, identify the client reason for look for the care, and identify the client chronic health problem. The best of choice is genetic disorder evaluate or family health problem find out. So genogram organize a family history into a graphics or flowchart. The nurse uses genogram to identify genetics or evaluate the familial health problems. A genogram does not identify previous undetectable diseases or disorders. The client reason for looking for care or chronic health problem, it is not the part of the genogram. And here, next question, a nurse prepared to palpate a client's maxillary sinuses. For this procedure, where should the nurse place her hands? On the bridge of the client nose, below the client eyebrow, below the client cheekbones, and over the client temporal areas. Best option is below the client cheekbones. So in this picture, we can see different sinuses: frontal sinus, ethmoidal sinus, sphenoid sinus, maxillary sinuses. So maxillary sinus, a type of paranasal sinuses, there are two large maxillary sinus. Like this picture, there are two, right? And one in each of the maxillary bones. Here we have two maxillary bones, and which are in the cheek area next to the nose, right? So below the client cheekbones here. So rational said, to palpate the maxillary sinuses, the nurse should place her hands on either side of the client nose, below the cheekbones, zygomatic bones. To palpate the frontal sinuses, the nurse place the thumb just above the client's eyes here, under the bony ridge of the orbit. No sinus are located on the bridge of the nose. No sinus is there, right? Or here. Next question. A client is admitted to the hospital. Question here. A client is admitted to the hospital with a pneumonia. He has a history of Parkinson disease, which his family say is worsening. Which assessment should the nurse expect? So patient has a Parkinson and also pneumonia. So they said impaired the speech, muscle flaccidity, or pleasant and smell demeanor, or tremor in the fingers, that is increase the with purposeful movement. So the answer is impaired speech. So pneumonia means an infection of the lungs and characterized by severe cough, right? With fever, chills, and difficulty of breathing. And also, my patient has a Parkinson disease and says impaired or difficulty of speech. In Parkinson disease, the dysarthria or difficult of speech, impairment of talking, result from a disturbance in muscle control. Muscle rigidity, not the flaccidity. So in case of Parkinson, we can see the muscle rigidity, not flaccidity. The causes the resistance to passive muscle strengthening. The client may exhibit a mask-like appearance rather than a patient feeling happy or good or pleasant, right? They have look like emotionless, no expression at all, and we call mask-like face. And also smiling, no smiling at all. Tremor should decrease, not increase, with a purposeful movement or sleep. So purposeless movement, not purposeful. Next question here. A nurse is conducting physical assessment on 17 years old female. Adolescent's mother asks to see her chart in order to confirm her suspicious that her daughter is sexually active or not. Which statement is the best describe how the nurse should protect the adolescent's right in the situation, right? So we are healthcare provider. Our first priority to protect my patient. So number one, inform the adolescent's mother that she must discuss the matter with a physician. But what is my rules? Number two, allow the adolescent's mother access to the child based on Family Educational Rights and Privacy Act. Number three, talk with the mother about the concept of protected health information under the Health Insurance Portability and Accountability Act. So HIPAA means Health Insurance Portability and Accountability Act. This is the rules and regulation or privacy rule provide the federal protection for personal health information held by covered and also gives the parent, it is the right for the patients to keep their health information private. And number four, determine whether the adolescent is emancipated minor before release the information. So first rules we have to follow what HIPAA said is a PPA. So the privacy rules standard we have to follow. The use and disclose of the individual health information. So it is protect the health information, right? By subject to the privacy rules or law. The rationale said the client for adolescents health policies and law that determine that it's the appropriate for a minor to exercise the privacy rights under the HIPAA, where or not the minor is emancipated. Therefore, it is not appropriate for the nurse to show the adolescent's health information to the mother without the permission. The physician is held to the same constitution as the nurse. So it is rules is equal for all. And we are healthcare provider, we have to follow the national guidelines and agency policies. And next here, when performing an adolescent abdominal assessment, the nurse should follow which examination consequence. So keep it in mind, you are going to examine or assessment the abdomen. First of all, inspection. Number two, inspection. Number three, inspection. And number four, all. But second, auscultation. But during the examination, first of all, we see it's called inspection, right? And last step is palpation. You feel superficial or light and then deep. It is the last. So here number two, last is called percussion, no. Last is auscultation, no. Number four, auscultation, no. For the lungs, auscultation is the last. But for abdomen, palpation is last. So the correct answer is inspect first abdomen, then put the stethoscope is called auscultation. Then we go for percussion, means tapering, and finally go for palpate. So the correct consequence for abdominal assessment is inspection, auscultation, percussion, and palpation, because these sequence prevent altering the vowel sound by performing palpation before auscultation. The correct sequence for all other assessment like lungs, heart, we have to follow inspection, palpation, percussion, and auscultation. For abdomen, inspection, auscultation, percussion, and palpation.